Good day and welcome everyone. Thank you for joining us for this special Gold Human Insight webinar on stress reduction techniques for frontline healthcare workers during COVID-19. I'm Pia Pine-Miller, Senior Director of Strategy and Business Development at the Gold Foundation. We are excited to be collaborating with Dr. David Fryburg and his nonprofit, Envision Kindness, part of our ongoing work to promote practitioner well-being and humanistic care. We're also thrilled to have so many partners, colleagues, and institutions with the Gold Foundation from all over joining us virtually. A few notes on David. David Fryburg is a physician scientist who says he has been privileged to work in academia, translational medicine, and leading teams of cross-discipline scientists in a public-private consortium. He is also the co-founder of Envision Kindness, a nonprofit with a mission to reduce stress and promote positive interpersonal connective through kindness, compassion, joy, and love. This is accomplished through multicultural images gathered from around the world. David is also the author of the Science of Kindness blog, published by several outlets, including Psychology Today. This webinar was created to provide greater insight into a likely complication of COVID-19, unprecedented levels of stress. There are multiple stressors affecting many millions of people simultaneously, especially frontline healthcare providers. This level of stress can cause a secondary burden on the healthcare system. Fortunately, there are very effective, no-cost techniques to combat stress and avoid secondary complications while the infection and economy are being addressed. David will discuss these methods, what is known about them, and how to consider implementing them. We are so thankful for David's work and his collaboration with us at Gold.
Well, thanks, Pia. It's really a pleasure to be able to collaborate with the Gold Foundation and talk to your audience about stress and COVID-19 and really understanding the consequences of epidemic stress and providing some simple interventions to help alter it and promote resilience. By way of disclosure, as Pia mentioned, I am the president and co-founder of Envision Kindness as a nonprofit, and I do that in the capacity as a volunteer. The content of my material and presentation doesn't include any discussion of unapproved or investigational uses or of biomedical products or devices, and I have nothing else to disclose. So the takeaway of all of this, and well known to so many of you, is that stress is very detrimental to both mental and physical health. Before COVID-19, stress levels were already high for patients, for healthcare providers, for the general population. But with COVID-19, stress has increased to unprecedented levels and on a population scale. It is really detrimental to health, and we have to be aware of it and mitigate it. Fortunately, there are effective, no-cost methods to help control it. And post the COVID-19, when this is all said and done, and eventually, of course, it will be, these methods can be very useful to help control the stress response. So before COVID-19, people were already experiencing a lot of stress. It comes from a lot of different sources: health, family, financial, workplace. I'm sure many of you are, have your own and are familiar with these. The American Psychological Association does a survey annually. In 2019, almost 70% of respondents say that both gun violence, including mass shootings, and healthcare and its affordability were major sources of stress. Before COVID-19, most Americans already felt that stress was too high. This is another graph from the American Psychological Association, and it shows over time both the perceived levels of stress and then what the average stress level was. And you can see that there's a large gap between what is thought to be healthy by most people and what they experience. And these surveys were done each year in approximately several thousand U.S. adults. And one of the other things that's worthwhile noting, because people like to at least understand what the financial or economic burden of stress might be, is that workplace stress, and where it has been attempted to be quantified, costs in the U.S. somewhere between $200 to $300 billion each year. A good part of that is due to health care. Another part of that is due to employee engagement and turnover. In the EU, this number has been estimated at around 600 billion euros. So again, before COVID-19, at least a subset of stress was already very expensive. Well, if bragging rights are possible, in this case, the U.S. ranks amongst the 10 most stressed countries in the world. So this is from Gallup Emotional Report, and they surveyed about 150,000 people across the globe, and you can see the position of how people responded to the question, how much stress did you experience yesterday? And 55% of the respondents in the U.S. said a lot. So that's for the general public. But providers, of course, experience more stress than that. And before COVID-19, they were already shouldering a lot on top of the everyday stressors that everyone has. And there are multiple reasons for it, and I'm not going to dive into that. And there are some very good initiatives that are being undertaken, including at the Gold Foundation, to try to reduce this. But the outcome of it was that burnout, depression, and suicide, before all this started, was about double that of the general population. So now with COVID-19, we know that stress has increased markedly on a population scale. You can see it in news broadcasters and how they report stories. You can see it in the politicians as they relay their daily briefings. You can read about it in the news, in individual stories. It is pervasive. For patients, but really for the general population, there's loss and grief over health and worries about finances and will I have work and will we have income? And it's compounded, of course, by loneliness and a loss of control over our own futures. And for providers, all of that is involved, plus trauma for those that are really on the front lines. And many articles talk about that as physicians, nurses, and other staff relay their experiences. So in so many ways, COVID-19 has created multiple stressors. A lot of it surrounds grief and loss, but the concern over getting ill for oneself, one's own relations and friends, family, for seeing those who are sick or who have died, for financial threats, for the food supply that is of concern. And then on top of all of that, loneliness and isolation. And overall, an uncertain, unstable future. So one way to look at this is that there are multiple attacks on Maslow's pyramid. Abraham Maslow is a psychologist in the mid-20th century who created this pyramid to try to describe a hierarchy of human needs. And you can see at the base of this pyramid from physiologic needs that include breathing, food, water, sleep, homeostasis, for safety, for employment, finances, health overall, for love and belonging directly related to loneliness and isolation, for friendship and family, and then including esteem because people develop purpose and work and out of work and why they are here. And all of these are being attacked in different degrees for different people simultaneously. So why address it now? This isn't a talk to stress you out about stress, not at all. But in fact, the primary things one might say, and appropriately so, is that to reduce the stress, we need to address the primary problems. First and foremost, of course, the virus. We have to find treatments and continue the mitigation and isolation and treatments including vaccination and other perhaps pharmacologic therapies. We have to support the economy, and people need money to be able to live on. Yet the problem is the resolution of those are now unknown. And so we've got to anticipate that with the existing level of stress, that there's going to be significant outbreaks or increases in stress-related diseases. And this will also further burden the healthcare system. So to support providers on a mass scale, we need to be able to educate people, to help train them, and to use techniques that are available and relatively and doable to change this. We also need to anticipate that stress itself can increase susceptibility to coronavirus or worsen its severity. And I'm going to come back to talk about that. So what disorders can stress bring out or worsen? Well, there's a long list. And in the table in this slide, I've endeavored to list some of the major ones. They include, obviously, in the major classes of mental and physical illness. And that includes, for mental illness, depression, anxiety, anhedonia, sleep disturbances, more rapid progression of dementia, drug abuse to numb the pain of the stressors and the isolation, as well as physical somatic pain of itself, because pain thresholds will drop in people who are stressed. Physical illness is also important here, and also very well known as risk factors for hypertension and stroke and heart disease and asthma and diabetes and obesity and infectious diseases and impaired wound healing and gastrointestinal disturbances. Stress also accelerates aging. Biomarkers such as telomere shortening have shown that in different studies. So taken together, there's a long list of reasons why we need to think about and try to deal with stress. One also measures emphasis, and that is, or merits emphasis, that is, stress increase the risk of major infection. There's a study from Sweden of over 140,000 people that showed that pre-existing stress increased that risk significantly. It also can accelerate the progression of viral infections. It's best studied, I believe, in HIV, where individuals who had greater degrees of stress, even after adjusting for medication use and other demographic factors, had accelerated progression to AIDS and worsening CD4 counts and increasing viral load. Another element that's important in here and needs to be acknowledged is about touch. It has to decrease by necessity. We have to slow down the infection rate, and so it makes a lot of sense. And then when patients, of course, are in isolation, that has to decrease because of the nature of isolation. But nonetheless, touch is a major way to connect and communicate with other people. It sends clear messages of either I care about you, you're of concern to me, as well as perhaps angry messages. But to focus on that positive, decreasing touch is also a stressor. It's been framed in the term touch deprivation. It's been most well seen in an extreme in orphanages for children who have been deprived of touch and have significant developmental and intellectual delay, as well as smaller brain size. So we have to think about the patients who are in isolation and the people that they are going without the touch of a caring family member or friend that is critical to helping them heal. So one of the things that is interesting to me in particular is, well, how does stress cause disease? And there are a lot of good studies in a discipline known as psychoneuroimmunology. And they've shown that psychological stress can alter, obviously, the autonomic nervous system and immune regulation. The classic fight or flight we've known of for many years, since Selye began its description, and it's cortisol increases and activation of the sympathetic nervous system are very well known. What's less well known, but is increasingly recognized, is that inflammation increases during stress. It can be measured by increases in CRP, increases in IL-6 or TNF, depending on the studies, and it may even happen within a very short bout of stress. In chronic stress, immune competence changes, and that can include both humoral and cellular immunity. So there are major shifts that occur with stress, and remember, inflammation may tie all of those other disorders together in their own ways. To add a little bit more perspective or view to this, loneliness, which is a pure stressor, is a major stressor, impacts mortality about the same as smoking 15 cigarettes per day. And then finally, we also know that stress can cause disease indirectly, like a lot of different things, but it can affect appetite, it can affect interest in exercise, it can affect drug use. Essentially, stress can affect how cognitive ability and how people make choices. And so taken together, all of these things summate into the disease list that we just talked about. So in the converse, I posit that decreasing stress would decrease disease, particularly on a population basis. It'll decrease the intensity of the disease, decrease incidence of new disease over time, as well as increase adherence to treatment and prevention as the person engages better in their own care. It has implications for asthma, heart disease, stroke, depression, but also implications for COVID-19. So I'd like to turn now to a few methods to help people decrease stress and promote resilience, particularly during COVID-19. But these have been around for a long time and are going to be very useful in many other circumstances. So there's meditation, exercise, kindness and compassion, interpersonal connection, and laughter. But the common thing, the common element of all of them, really, is they tap into programming we are born with, that programming that allows us to heal ourselves, to reduce stress, and to regain a foothold in happiness. So to start with meditation. So this illustration is that of a sad young woman with a cityscape that depicts what's going on in her mind. The billboards are some thoughts that are streaming through. Some of them are nothing goes right, life is tough, I'm a failure, might be some things that people feel, think from time to time, or they may be fearful, such as now, like, will I get sick? Will my family be healthy? Etc. All of which end up yielding stress. The thoughts that run through our heads, the chatter, if you will, is usually negative. It distracts us from being present and being able to savor life more fully, which in and of itself causes a stress response. We feel it, we know it. And so the technique or the use of meditation is to try to be more present. So there are different practices that help people to do this, to not attach to these thoughts and to be more present. There are religious, there are secular methods. A lot of them end up having a very similar outcome. They would cause greater awareness, less judgment, more forgiveness, more letting things go. And the intent, and this is really important here, is not to distract the person from all these negative thoughts as if you're watching a movie to take you away somewhere. The intent is to be more present so these thoughts don't distract you and allow people to focus, to breathe, to feel more relaxed. As a result, studies in meditators have shown that they experience significant decreases in stress and reciprocally increases in feeling calm and then happier. They also become more emotionally resilient and they buffer new stressors or challenges better. So when the next event occurs, when the next problem arises, they're able to affect what their response is or attenuate that response. The health benefits of meditation have been shown, certainly at least short term, and it's really about decreasing the stress response, including decreasing pain, decreasing inflammation, changing blood pressure. A lot of this may occur through the parasympathetic nervous system, through the vagal activation. There are some longer-term CHD studies, but they're sparse. There's evidence for secondary prevention of coronary heart disease, but not yet primary prevention. Nonetheless, the American College of Cardiology and the American Heart Association recommend it as an adjunct to treatment. But beyond giving you some information, what I'd like to do is practice with you. For those of you who are experienced with meditation, that's great, and you can enjoy this too. But really, for those that don't know how to begin, we're going to take a couple of minutes and just start. I'm going to separate the meditation into 3 different parts. The first one will be just about breathing. The second, it'll be involve thoughts of compassion and loving kindness. And the final part is about gratitude. As I go through it, and I'm going to give you instructions, that a lot of thoughts may pop through your head, like, for example, when is this webinar over? Or I have things to do, so can we cut to the chase? As those thoughts are manifesting, just go back to what your practice is. Just go back to either the simple breathing, etc. So what I'd like you to do is sit up in your chair, your feet flat on the floor, your hands in your lap, your spine is erect so that your head is straight. And what you're going to be doing is you can look at this image or use it as a starting place and imagine that you're sitting by the bank of a river and that there are clouds that are floating by. And those clouds are going to be representative of your thoughts. And what you'll do is that you'll know that this is true, that they're just thoughts, and you're going to let them pass by. So just be prepared, because it happens to everyone, including me, every single time I meditate. So close your eyes. You're sitting on the bank of the river. Feel comfortable. You shouldn't have any stress or strain anywhere in your body. And just be sure that you're comfortably seated. And start to inhale through your nose slowly to a count of 4. So, and I'll start. So inhale, 1, 2, 3, 4. Hold it. And exhale, 1, 2, 3, 4. And inhale, 1, 2, 3, 4. Hold it. And exhale, 1, 2, 3, 4. And keep breathing like that. But as you inhale, as in your counting, feel your belly expand. And then you hold it. And then as you're exhaling, feel it release and contract back down again. And do it one more time. Is inhale and feel your belly expand. 1, 2, 3, 4. Hold it. And exhale. 1, 2, 3, 4. Now keep breathing as I'm talking, counting to yourself. Feel the air going in and out through your nostril. Be aware of how your abdomen, how your belly is changing. And then when you're ready, start by sending wishes for loving kindness and compassion out to those whom you love, for your family members, and for your friends. So as you inhale, you're thinking of them and you're wishing them good health, a good day, kindness, and love. And you keep breathing. Don't stop. And you can count if you need to, or stop counting as you're sending out loving kindness and compassion. And then what you'll do is, after several breath cycles, you shift and you extend that loving kindness and compassion to everyone who lives in the town or city in which you live. And you keep breathing. And you're connecting to all of them through loving kindness and compassion, through your wishes for them. And you go through 2 or 3 breath cycles, still feeling the breath through your nose, still feeling your abdomen expand, but you're sending out loving kindness and compassion. And then finally, you're going to send it out to everyone around the world. So everyone has health and healing and joy, and that they can feel how you care about them. And you do that for a couple of breath cycles. Inhale and feel the breath coming into your nostrils, and then exhale with it. And then finally, and this is much shorter than normal, but for the sake of brevity, lean back and reflect, still sitting up straight, and think about one thing that you're grateful for that happened yesterday. That could have been a great meal. That could have been a friend reached out to call you. It could have been something that you did or saw someone else do. It doesn't really matter. Anything that you're grateful for. Okay, now come back, open your eyes, and you can see and check for yourself how you feel. And that was a very, very short meditation done for the purposes of this webinar. But that will give you, particularly those who haven't experienced it before, a good sense of what it could possibly do. So my recommendations for meditation are to try it daily and do it at a regular time. I myself do it the first thing in the morning after I'm up and around or a little bit, because the day often, gets on, it has its own momentum and takes off. And this way I know that I'm able to get it done. 5 minutes is great to start. You can set a timer to do that, but 15 to 20 minutes for better effect. And if you think about it in terms of your overall budgeted time for the day, it's fairly small. You can also use it if you're stressed. So clearly, if something's coming up and you need a moment, even taking a couple of breaths and recentering can help a lot. And there are many terrific and experienced teachers to help guide you. And you can find them on the internet. We've also listed them on a resilience resource page on the Envision Kindness website. You're welcome to use that. It's there for you. But do it regularly, because what you'll find is that you'll get time back. In other words, time will be more productive and more enjoyable with the regular use of meditation. And remember, those thoughts will always come and try to intrude, but once you're doing this regularly and for long enough, they'll start to quiet down because they don't have a home. Okay, so the next method I want to talk about is exercise, which is much better known for stress reduction. Regular exercise, of course, is key. Aerobic, in particular, 20 minutes, and if it can be done daily, is great time. If people want to do more or even less, and as tolerated, of course, and they're physically able and without limitations that disorders or other problems that would cause them problems. So, and any questions, my disclaimer is, for those who are non-medical professionals, consult one if need be. But it's doable in a confined space, particularly in isolation. There are lots of resources online. We have some of them on the site, but there are many that you can find. You don't need much equipment, and many of these resources show how people can exercise very effectively just in their apartment using furniture or other floor space that's available. But one of the points that I want to emphasize is that the mind, of course, affects the body. That's the first and major part that we've talked about so far. But it's also true that the body affects the mind. So this is a loop, right? And so we need to activate this loop and engage it to maximize its benefit. Most exercise, of course, has a meditative component because if you're physically active in doing something, you have to be present to some, at least to some degree, to be able to perform it well and avoid injury, etc. But there are several others that emphasize meditation. Yoga in particular, many of you will know about, many of you will do. It's widely popular, and there are multiple varieties, including laughter yoga, for example. Stretch is an important part of yoga, is terrific because it helps induce a relaxation response. I myself am a long-term practitioner of Tai Chi and Qigong. They're two old arts that have been known as moving meditation, in particular Tai Chi. And the reason for that is because in order for the practitioner to do it well, he or she must have a sense of stillness and centering that allows them to project their intention most effectively. Connecting with nature is also a stress reducer. So performing exercise like hiking or walking or running outside and while in contact with nature can further decrease stress. This has been shown before. And similarly, gardening can have a significant caloric expenditure and allow for the interaction with the natural environment so that you can get several different effects all at the same time. And gardening is nurturing. So you're attending to promote the growth and health of plant life, which leads us to the next topic or method, is kindness. And kindness is just a powerful natural antidote to stress. And it really does it because it connects people. So we've talked about it before. People have an innate need for positive social connection. It is built into us. It's why loneliness is such a powerful stressor. We need to belong and feel supported. We need to have value and purpose. And it's clear that social connection buffers the stress that comes from other events and from isolation too. And the reason it does it, I believe, is that it sends messages that you matter. I see you. You are important, and we have purpose, therefore, and value. The neuropsychology of kindness is particularly interesting in that in addition to doing acts of kindness, and remember the old adage about the giver and the receiver both benefiting, but the giver in particular, is that simply seeing it has positive and beneficial effects. And you can know for yourself that this presentation has some of the images that we have on our site, and you can know for your own reaction from it. When it's been studied by others in video format, it generates reward response in the brain. It can also change people's behavior. It colloquially, and I think aptly, was called the alliterative helper's high. And then finally, it builds trust, and particularly for patients and the understanding of compassion and the interaction and healing per se, it's really important. So the nonprofit that I run is called Envision Kindness, and we use images of kindness and compassion to uplift people and help them connect better. So by that way, we can promote these, not only first the emotional response, but also hopefully a behavioral response through the use of the images. And that they'll reduce stress and strengthen interpersonal connection because they tap into something that's so basic. when people who have seen these images, and we've studied them, they're happier, they're grateful, they're more compassionate, and they're more generous. So what we've done is taken these images and incorporated them into video and streamed them in, and the intent is streaming them into stressful environments. We're starting with healthcare settings, but other stressful environments are perfectly appropriate because it's anywhere that people can need that lift and help reconnect to their humanity and really to their core of being. And these work rapidly, and I'll show you some of that in a second. Okay, here it is. So we did a study in a healthcare setting. This is a pediatric dentist's office, and so trying to do is first real-world study. There were 51 people who participated. These were parents and staff as a mix. And what happened was people completed a questionnaire, had 8 minutes of either seeing the usual content, which was children's programming, unlike, for example, watching CNN, or that they saw Inspire for 8 minutes. And after that, they completed some more questions, and the survey study was over. The graph on the right shows you what happened to one, in response to Inspire, one of the questions, how inspired do you feel? People who saw the children's programming had really no effect at all, where 1 is no change. People who watched Inspire had a marked increase in feeling, reporting being inspired. And they were asked other questions like, are you moved, are you touched? And these were all similar. In addition, they were happier, they were calmer, they were more grateful, they tended to be more optimistic. And this is, of course, all in comparison to what the clinic usually showed. In addition, a test of generosity was done, and based on a donation opportunity to a needy family. And people who saw Inspire had about twice the response in terms of donated twice as often as those who watched the children's content. And then finally, the vast majority of people who saw it wanted the practice to continue it. But the point is, it's not just Inspire or kindness content. It's or our content. It's kindness content everywhere. And it says that seeing this kind of content can positively change how people feel in a very pro-social way, and that's how they behave. So how to use kindness in stress, how to reduce stress, and how to tap into this. Well, the first is people also need to be kind to themselves. They need to recognize, their limitations and forgive themselves and take care of themselves through meditation and eating well and exercising, etc. Self-kindness is very important. And this is not about selfishness. This is about nourishing oneself so you can be more positively connected to others. And then in that spirit, reach out, support other people. Let them know that you're thinking of them and care, that they matter. Even a text, a call, an email, something in this very virtual world, just like I'm giving this talk today, tell people you're important. You can donate, of course. You can volunteer in different ways, in whatever capacity that suits you and fits what you want to do. This is really important about making things sustainable. And then, in between, look at images of kindness. And on our website, we've listed other sources in addition to ours. There's a group that publishes KarmaTube and Uplift TV, and there are a variety of places, the Good News Network, if you want to get a dose. And microdosing with this kind of content is really good to help balance our humanity. I believe that this has relevance to healthier communities in the long run, and for overall community well-being. It'll have effects on patient engagement when used in the long term. And hopefully, healthcare costs will decrease because of that, because people are more invested in that relationship, in taking care of themselves. And of course, this notion that kindness is contagious is important. Just like COVID-19 is highly contagious, it turns out so is kindness, and what I'll mention next is laughter. So it ripples outwards, and so this wave propagates, and so one act begets another. And this is important because it can auto-propagate and people can become change agents themselves. So an interpersonal connection is really related to, I think, the strength of kindness, but there are other ways to do it. And showing caring to one another is a great way to connect, or even sharing things together, connecting in some way, sharing a piece of something that interests you, that you might find someone else interested in. That's really important. And in case there's any doubt, this was described very long ago. It's well known that we are social animals and that we need to connect. Darwin recognized this. Many people may not realize this, but Darwin had written that it was altruism, that sacrificing for other members of the group was necessary for the group to survive, or the species to survive, because, he said, if they didn't sacrifice for one another, then the species would die. And you can see that in a lot of different species, not just humans. This is a basic quality that in nature has given us the reinforcement through reward systems to say, this will make you feel good. Do it. Let me give you a benefit to it. And of course, the corollary to that is what I had mentioned, is that loneliness is associated with an increased mortality. And so the final one is about laughter. And laughing is great, obviously. Norman Cousins, who was a writer and editor in the mid-20th century, as well as a philosopher, popularized the notion of laughter's healing properties. He had been diagnosed with ankylosing spondylitis, was in a lot of pain, and decided that he didn't want a traditional approach. And of the 2 or 3 things that he did, including seeking this alternative and using laughter, was to find the old comedy movies that he liked and just watch them. And what was also noted was that he could markedly decrease his pain from laughter, and that it would last for a while, and that once it had worn off, which it eventually did, from the descriptions that I have read, he had re-engaged and watched another movie. And so he was doing microdosing with this. But it turns out that it's been recommended as a therapy for centuries. And more contemporary studies have shown that it induces muscle relaxation, lowers stress levels, can help with learning and retention, perhaps because people are more relaxed. It can decrease the wheal allergic responses in atopic dermatitis. It can may lower cortisol and affect natural killer cell activity, and has been reported to decrease inflammation markers in patients with RA. And on a related note, laughter is contagious, and it also encompasses, there's a neurobiology or neuropsychology of smiling. And so I think these are all tied together, are ways that we have built in to naturally reduce stress. However, in this case, find films that you like, or read things that you think are funny. Sharing them with others, because of this contagious property, can help amplify it. So do that on a regular basis. It's part of something to nourish yourself. So the takeaway from this is we have to be cognizant that COVID-19 has markedly increased stress on this population scale. Stress is very detrimental, as we've talked about, to both physical and mental health. And understanding the corporal mechanisms, the pathobiology that goes behind this, can provide insight and a drive to try to fix it. With, importantly, I think, inflammation as being a common intersection in a lot of this. meditation, exercise, kindness, connection, laughter, all tap into this natural ability to heal. It provides a very attractive way to affect the population, to affect both the providers and the staff, but also patients and the general population during and after COVID-19. So we just need to do it. It's encourage use of these techniques for yourself and for your loved ones. Share them with others. Feel free, and the resource page and other sources, doesn't matter if it's ours, go look to those resources because it's simple, it's relatively easy, it doesn't invoke any new technology, and we can use what we already have. There are many organizations that are offering free resources. I've reprinted our webpage for your reference, but again, please seek out what works for you. And if you're interested, we have a short reel from of Inspire that's available to access. Please reach out. My email is at the end of the talk. Of course, seek help if needed, because for some, these techniques may not be enough. So don't wait. It's not about being tough, this notion of toughing it out and making it through. While that's important, resilience and strengthening resilience is what makes people tough. And that's about also being smart and understand what works. So there are many resources for that. I've listed, there are two in this presentation, but you can get them from the American Psychological Association, the CDC, and there are others that may also be exceptionally helpful. But the bottom line is, if you need the help, please seek it. So I want to thank you. I thank you for making it through this entire webinar. Thanks to the Gold Foundation for collaborating with me on it. It's really been a privilege. And at this point, I will turn it back to Pia.
Thank you, David, for being a change agent and Gold Ambassador. Please reach out to me to learn more about our programs and webinars at the Gold Foundation. Thank you for everything you do. Please take care.
Bye.